Here I'm going to do an assessment of breath sounds on your lungs. So every time I place the stethoscope down, I want you to take a deep breath. Ready? Go ahead, take a deep breath. 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 And get under your band. Deep breath. Deep breath. Lastly, each side. And breathe. I'm going to do the back side, so go ahead and turn your back towards the camera. All right, here we go. Breathe in. Deep breath. There you go. Deep breath. Deep breath. All right, thank you. That concludes that. Now I'm going to measure your oxygen saturation in your blood using a pulse oximeter. Turn it on. Finger in. We'll wait. Here it reads 97. Normal levels are 96 to 100, so you are considered normal. So here we are going to use the peak flow rate meter. I have it set to 0. I want you to take a deep breath and seal your mouth over the edge. And I want you to blow out, exhale as hard and fast as you can. We're going to do this 3 times and we will record your best measurement. All right, here we go. Okay, it reads 355. Reset, do it again. We have 400. Reset. One last time. And 400. So here, 400 is our highest number. For question 5 on the exam, a patient came in to me with a bottle of medication or supplement that says it can improve airflow. And so here is my counseling session with them regarding the product. Okay, so thanks for bringing this to me before you try it. I want to be honest with you that products like this claim to open your lungs or improve airflow usually rely on ingredients that cause bronchodilation, which is something we typically only see in like inhalers for asthma or other prescription medications for asthma. So for a healthy person, taking a supplement like this won't really help. It could potentially be harmful, which I want to warn you of that. Supplements like this aren't regulated the same way as medications that are prescribed to you, so we don't really know what's in them, or how much of this ingredient there is, or if it's even safe. There's also a risk that it could contain something that is banned, which could affect your eligibility. So if you're having any trouble with your endurance or breathing, it is safe or the safest move is to probably talk to your doctor or team physician. So let's just work on this the right way so you can stay healthy and eligible to compete. Thank you. Clinical exam question 6. I have an athlete that is training for a 10K that will, and they're asking for some advice to acclimatize to those conditions. Okay. So that's awesome that you're training for a 10K, and good thing to ask about the altitude ahead of time. At 6,000 feet, the air has less oxygen, so your body will have to work harder to get the same amount that you're used to at sea level. Ideally, you'll want to arrive at the altitude about 2 weeks, 10 to 14 days before the race, so your body can start adjusting and your breathing will help. Eventually, your breathing will speed up, and over time, your body will produce more red blood cells to carry the oxygen better. If you can't get there early, try to train as much as you can in hot and humid conditions, or even use a mask or elevation, or you can go somewhere for elevation stimulation training if it's available. Although those don't replace the true altitude that you'll be in. Focus on pacing during your race and staying well hydrated. And remember, the first few runs, when you get there, they will feel harder, so don't get discouraged, and your body will adapt, especially with time and consistent effort.